COVID-19 update for Thursday, November 5th. Today we mark a terrible milestone for the state of Illinois. Following our largest single-day increase in deaths since early June, Illinois has now surpassed more than 10,000 Illinoisans lost to COVID-19. Each day we are losing more and more of our neighbors to this virus. That's not a trend that's going to turn around on its own. It's up to us, all of us, to do something to save the next family from tragedy. Because unfortunately, it could easily be yours. And to all those who have lost someone to this horrible, invisible virus, I am so sorry for your loss. I am so sorry for your grief. I'm so sorry that your personal tragedy is folded into this public one. Please know that the state of Illinois stands with you. We won't let your relatives, your friends, be forgotten. Please join me in a moment of silence. To all Illinoisans, I cannot stress enough the severity of our situation. IDPH is looking at proposing further regional and statewide restrictions because the rise in cases and hospitalizations is unsustainable. But I cannot stress how important your individual actions are right now. What you do, what we all do, will determine how much worse the coming weeks will look. We are seeing record numbers of new COVID-19 cases across the state. Our community transmission rates are at drastic levels. In the last week alone, we've seen our state case positivity climb from 6.9% last Thursday to 9.1% today. And our test positivity, which we use for mitigation decisions, similarly climbed from an average of 8.2 then to 10.5% now. In 1 week. Yeah. 1 week. That's on top of massive growth since the beginning of October. We've seen our case positivity rate in the state nearly triple. As has been the case for weeks now, this comes as Illinois sets new records in testing. Today we reported our 8 millionth test, and we're now averaging more than 82,000 tests per day. That's good news, and we're continuing to build on that. But at this point, the rate of growth in our positivity is far outpacing our growth in testing. In other words, the more we test, the more we're finding people infected with the virus. That's awful news. Offsetting that is that we're finding infected individuals earlier, both because people are getting tested when they're contact traced or when they're, exposed to someone who is sick. Both of those things, really. Don't wait until you develop any symptoms. The earlier that you test, the more likely you can limit the spread of the virus to your family, to your friends, or your coworkers. Across the state, our regional test positivity rates continue to reach new heights. Today, the region with the lowest average in the state is at 10.0%. That's Region 6, East Central Illinois. Region 1, the Northwest region, is at an alarming 15.8%, with Region 7, Will and Kankakee counties now following closely behind at 13.4%. Last Thursday, we saw a rolling average of 2,700 COVID-19 patients in our hospitals statewide. Today, that average is up over 3,400. That's up 120% since the beginning of October, when we were averaging just over 1,500 people in the hospital fighting COVID-19. Just think about that. We have more than doubled the number of people in our hospital system with this disease in just about 5 weeks, with no sign of slowing. We are just 3 weeks from Thanksgiving. We continue to see rising numbers of severe cases trailing rising hospitalization rates, which, mind you, is already a sign of severity on its own. The number of COVID-19 patients in the ICU is up more than 100% since October 1st. We entered last month with an average of 360 COVID-positive ICU patients in the hospital, and today we've more than doubled that with an average of 724. And since the beginning of October, the number of people fighting COVID-19 on a ventilator statewide climbed from around 140 to more than 300. Across the nation, we're seeing states and cities affected by this growing crisis, and they're responding by rolling back their reopenings. And over in Europe, France, England, and Germany are rising at such a quick pace that they're resorting to much more significant restrictions on all non-essential activities, as they too face case numbers and hospitalizations rising at a tragic rate. Remember that Europe fared much better than the United States over the last 5 months. So when they impose those severe mitigations, it's an indication that the virus is raging out of control there, and we are heading in a similar direction. The vast majority of people in this state want to keep themselves safe, their families and children safe, their parents and neighbors and friends safe. And they know that masking and distancing and limiting public gatherings are the right way to do it. But if others don't change their behavior, which we're going to experience, if they don't change their behavior, we are going to experience a surge in hospitalizations much higher than where we are now. And in some areas of our state, that will mean that you'll run out of hospital beds and nurses and doctors who can treat you. If the current trajectory continues, if our hospitals continue to fill up, if more and more people continue to lose their lives to this disease, we're going to implement further statewide mitigations, which nobody, and I mean nobody, wants. So we have got to get these rates of community transmission down. And the only way that's going to happen is if mayors and city councils and county boards across this state stand up and say, this needs to change. Far too many local governments across the state are failing to enforce any mitigation measures, allowing this continued rise in positivity to balloon out of control. It's time to take some responsibility. That's the only way that we will get out of this without having to implement more and more restrictions across more industries and across the entire state. Because frankly, I can tell you that these numbers are drastically increasing. And I can tell you that till I'm blue in the face. But if local leaders don't step up, if high-risk industries don't act accordingly, if families don't put off that gathering or dinner party, if people don't wear a mask, we're heading down a very dark, dark path toward where we were last spring. Let's not let that happen. With that, I'll turn it over to Dr. Ezike.
Thank you, Governor, and good afternoon. Just following up after what the Governor has shared, both in his words, graphically, the message is the same. And to follow on that, I need to talk about the upcoming holiday season, traveling to see family and friends. We just really need to think about this. Let's be clear, travel will increase your chances of contracting and spreading COVID-19. as will going to a crowded event, as will having multiple people in your home for Thanksgiving. So in terms of travel, we do recommend avoiding travel to areas of higher risk, but as you are seeing, that is almost everywhere. That includes essentially every county here in Illinois, that includes almost every state in the United States, and many countries around the world. Visiting counties, states, or other countries where there are fewer cases of COVID-19 might be a little less risky than visiting locations where there are higher rates, but there's still a risk, and there's just even the risk of just the traveling process. I want to make sure that every person watching, every person listening understands that there is significant potential for harm and death. Let's be very plain. And it's not just to yourself, for the people who feel nothing could ever happen to them, but it's to other members of your family and other people that you may not even know that you could unwittingly spread the virus to. Ultimately, the decision to travel or to have an event or to have a large Thanksgiving feast is yours to make. But I want to make sure that you can't say you didn't have all the information and the knowledge that COVID-19 is a serious disease. It's led to millions of hospitalizations and hundreds of thousands of deaths worldwide. I realize that some people may still choose to travel. Maybe you need to travel. Sometimes you'll have to travel, and in those instances, we are trying to provide guidance to help accomplish this in as safe a manner as is possible, knowing that we could never fully mitigate all the risk. So consider how you're going to travel or your mode of transportation. Obviously, when you fly, there are security lines as you go through the airport terminals. Think about a flight with layovers where it may be cheaper, but obviously that will pose more risk than a direct flight. Traveling by bus or train versus taking your own vehicle. Obviously, taking your own vehicle, if that's an option, would be safer. Traveling by bus or train, you might not be able to maintain 6 feet of distance, and sometimes that will be for extended periods of time during the journey. If you are driving your own personal car, plan out how you will do the stops for gas, for food, for bathroom breaks. Think about hand sanitizer and washing your hands frequently. IDPH has issued travel guidance and created a travel advisory map on its website. This is to help you make more informed decisions about travel if you have the choice or if you can postpone, but you can look there to see what's going on around the world. This is available at www.dph.illinois.gov/travel. We all want to be with our friends and family for the holidays. But perhaps this holiday, as we have already done for most of 2020, we are going to have to do it COVID style, and that means virtual. We'll have to stay at home and forgo the large gatherings so that we will have future events that we can be with our friends and family. Today, we are reporting 9,935 new cases. These are not duplicates. These are not people who took 5 different tests. These are new individuals diagnosed with COVID for a total of 447,491 cases. And as the governor mentioned, that includes 97 newly reported deaths for a total of 10,030 lives lost. And not that the 97 is not enough, but that includes individuals in their 20s, 30s, 50s, as well as people in their 60s and over. 3,891 people were reported to be in the hospital overnight with COVID-19, and of those, 772 patients were in the ICU, and 343 patients were on ventilators. In the last 24 hours, 86,015 tests have been reported for a total of more than 8 million tests. So as always, let me close with wear your mask, please. Wash your hands, please. Watch your distance to other people. And if you haven't already, get your flu shot. We are really at the point where we are concerned that whether you have the flu, whether you have COVID, whether you have chest pain, whether you have stroke-like symptoms, we are worried that there won't be a bed enough for everyone. So let's make some decisions now to decrease from the nearly 10,000 cases today. We can do something about the future number of cases that are identified. Thank you.